afternoon, everybody. I'm talking about anaerobic bacteriology of middle air aspirates in the developing world, the possible role of immunocompromise in its etiology. I have no disclosures. Now, we all know that chronic suppurative otitis media, it's the organisms, usually bacteria, have been implicated. We know usually there's superimposed fungal infections, hence it tends to be mixed, and this constitutes a big burden, particularly in sub-Saharan Africa. Risk factors has been alluded to by the professor from Bangladesh, are pretty well stated. Immunocompromise is a key thing, especially diabetes mellitus, based on several factors. Hence, the study intends to report the profiles of anaerobic bacteria isolated and attempts to evaluate the impact of immunocompromised status of patients on the disease. This is a prospective hospital-based study of 104 consecutive consenting participants with clinical diagnosis of chronic suppurative otitis media attending in the ENT outpatient clinic at the University of Ilorin Teaching Hospital. The duration of the study was 7 months. This was conducted after ethical approval had been obtained. The main inclusion criteria was documented history of purulence discharge via a perforated tympanic membrane of at least 12 weeks, and the exclusion criteria stated. I'll give you some time to look at that. Okay. By way of the materials and methods, to ensure that there were no contamination, it was important to ensure that the middle air aspirates were taken aseptically, and this was done for both ears in case of bilateral infection. Each of these was inoculated into Eropsin cooked meat medium, enriched medium for the anaerobic bacteria, while the other ones were just in the Stuart transport medium. And the microscopic culture sensitivity was carried out at the microbiology departments of the hospital, which is about 10 minutes from the clinic. So immediately those were taken, they were sent immediately into the laboratory. Antibiotic susceptibility testing was done using the Bacteroides and Streptococcus discs, and data was collated using the SPSS version 18. The results were then presented in descriptive tables. A p-value of less than 0.05 was identified as being statistically significant. A total of 11 patients had chronically discharging ears of the 104 studied. Age ranged from 4 years to 50 years. There was a slight female preponderance. The mean age was 16.3, and the standard deviation was 18.8. The low socioeconomic class constituted almost half of the patients studied, and the age range of patients with anaerobic bacteria occurred in the extreme of ages. As you can see from this slide, that the low socioeconomic class was essentially the most involved, and there was quite a large percentage of the study group being female. Also, Peptostreptococcus was the major organism that was isolated, considered 8 out of the 11, while Bacteroides was about 3. Then the other aspects were the aerobic bacteria. We also note from this slide that the antibiotic susceptibility pattern, we had 62.5 to Peptostreptococcus. The Bacteroides was essentially 100%, but the others had differing responses to the antibiotics. Then looking at this is a comparison of the immunocompromised patients. That is the group A, and the with anaerobic bacteria, this group 93 without. Now 2 out of the 11, that's about 40. 2 out of the 5. Out of this group A had 11. Now out of these 11, 5 of them had immunocompromised status. Malnutrition 2, HIV/AIDS 2, diabetes mellitus was 1. while for the other group, that is cases without anaerobic bacteria isolated from the middle air aspirates, only 5 out of the 93 had malnutrition, a case of malnutrition. 4 out of 93 had issues with HIV infection, and diabetes mellitus was 4. The power of the study was 70%, which was significant. Now, the study, has been said, noted a female preponderance. Some other studies, there was a previous study that was carried out in the same center that noted a male preponderance. So we're asking ourselves, why was there a change? Well, we felt that these days of improved female awareness and gender sensitivity might have prompted earlier presentations. Also, we noticed that the work that was done in Nepal also noted a male preponderance. This was explained by the increased outdoor activities of the males, which was also corroborated in other studies in Asia. About half of the study population were from the low socioeconomic class, and Lasisi, and that study that was done in Nigeria, noted that there was 7 to 8 times the odds of developing otitis media in patients from this group of this socioeconomic class. And other studies have also shown that the higher prevalence of infants from high socioeconomic class could also have issues as related to infants' feeding practices, cigarette smoking, and daycare attendance. The organisms isolated, that's Peplos, Streptococcus, and Bacteroides, were all associated with mixed infection. This is similar to the study that was done by Rotimi, in which he noted that Bacteroides fragilis particularly considered 42%, and the commonest agents he used were metronidazole and gentamicin for the therapy. The relatively low prevalence of anaerobic bacteria reported from this study might have been due to the high incidence of tubotympanic, that's the central type of perforation that was recorded, as the anaerobic bacteria tends to be mastered with cholesteatoma and granulations. And this finding is corroborated by the work of Ibekwe and Maggi and Silverstava, also in earlier studies. The low anaerobic organisms isolated, just 11 of the 32 isolates, might have been due to the duration of incubation. We used 48 hours incubation period for this study. Other studies who had higher yields from Indonesia and Europe actually used longer periods. Some of them range from 48 hours to 2 weeks. So a longer duration of incubation might have resulted in a higher yield. Also, the study noted that the anaerobic organisms appear to occur more in the extremes of ages, and hence the immunity of the patients might be a factor in its etiology. Of course, you may ask me that 40 to 50 years is not strictly extreme of ages, but in my own country, the life expectancy is really low. It could be as low as 55 years. That's it. So, you know, it's not extreme of ages in the real definition of things, but in a country that's life expectancy is not fantastic, then that becomes significant. The work of Isaac Brook also showed, which was done in the pediatric population, did not, however, make such age distinctions. Presence of comorbidities has been stated, actually associated with lots of documented comorbidities. That is, the proportion of A was quite much higher, statistically significant, as opposed to B. And presence of this immunocompromised status might have played a part in the chronicity of the problems of these individuals. A longitudinal study that was done by Bell Nates in Argentina amongst HIV patients noted that the prevalence of this was about 13.4, and severe immunocompromise was statistically significant. This was also alluded to by the study that was done in Angola, East Africa, in which persistent otorrhea was associated with immunocompromised status. In conclusion, the study reported a female preponderance, as been stated earlier. Also, there was a strong association between patients with anaerobic bacteria cultured in middle ear aspirates and the presence of comorbidities. in which the power was 70%, which was significant. There was an association with the ages, extreme of ages. Hence, immunocompromised status and extreme of ages played a crucial role in this group of patients who had anaerobic bacteria isolated from their middle ear. However, we must note that the sample size was pretty small. It was 110. Also, given this small sample size, then the hospital setting of the study, there might be need to carry out a larger community-based study, which might actually give more insight to some of the peculiar findings that were reported in this study. I want to acknowledge Professor Isaac Brook, who actually went through some of these manuscripts and made very useful contributions, and also the research individuals I worked with, Mr. Abdurazak and Mr. A. Odekomi, who handled the middle ear aspirates during the laboratory aspects of this study. These are my references. Okay, that's a small picture of our hospital. You're all welcome to take a break and come and visit us. I'll now take questions. Questions, comments? Thank you.